Okay, so we'd like to thank our 54 followers. Thank you very much for deciding to come along on this rather interesting journey. To start our video today, Steve would just like to go through what his cancer is and what treatment he's got to look forward to.
Okay, well, the main focus is the cancer is hepatocellular carcinoma. You can look that up. It's been on its way for quite some years, and that was through contracting hepatitis C, and then eventually developed into cirrhosis. Hepatitis C has gone a long time ago, but obviously left a lot of scarring and a lot of tissue, which is ripe for cancer to embed itself in. And indeed, last year, it did. They've been monitoring sub 10 millimeter areas for quite a while. And as you might know, as soon as they get larger than 10 millimeters, they take action. At the start, there was just the one tumor, but that grew to the state last year where ablation surgery was carried out, and the vast majority of it was blasted away. Here's the however. However, it spawned a bigger, more aggressive brother, and there are 4 satellite tumors, all sub 10 millimeters in diameter, in the liver. So everything is trotting along at a nice pace until 6 weeks ago, when a scan was carried out, and the almost discernible trace from last year had grown to 30 millimeters in diameter. That caused the consultants to call me up and to advise me that although I was on the transplant register and ready, all offers of transplantation and surgery were withdrawn because of the size of the tumour, and that it had 4 satellites waiting to take its place. A month passed and another scan was carried out, and in that 4 weeks the tumour had grown by another 4 millimeters in diameter. So I think we can safely say that this is getting a bit of a move on. They're now acting with some urgency, and I'm getting prepared to endure 10 days of treatment through radiotherapy called SABRE. This is a day of treatment, a day off, a day treatment, day off. It's quite humane, I suppose. That caused me to go to hospital for the day, really just for training. So you're trained in the correct breathing techniques, warning you that there is going to be tubes and implements inserted into you. And at one point during the procedures, they will actually stop your breathing. So you have the bed ready for me is already positioned with the positions for the arms, and I've had 3 tattoos put on my chest as to where the beam path is going to be, and I'm prepared and ready for that. It's quite an uncomfortable thing, mainly because I've got a frozen shoulder, and you're forced to lie on your back, arms above your head, for up to 25 to 30 minutes. That's not too bad, but when you try to unfold yourself from that position, the pain can be pretty horrendous. I've already been supplied with drugs for that, and with another set of drugs that are going to stop me vomiting, because I'm told the procedure will cause vomiting. Yeah, can't wait. Something to look forward to. So that's about it treatment-wise. I've just had a brand new letter from the consultant, and the SABRE procedure can be potentially curative. But obviously there's the big tumour to blast. It's got 4 brothers coming up underneath, so you've just got to wait and see.
And also they can't go too close to your artery.
No, it has positioned itself in a rather unfortunate place near an artery, so they cannot nibble all of it away without the good risk of causing some damage. And we don't want that. The path of the beam, as by the surgical team, I've been told it will do slight damage to one of my kidneys, and it may damage my duodenum. That might be a price I'm prepared to pay for that. So we're all raring to go. There's a telephone call booked on the 5th of January where they're going to talk me through it once more. Find out, you know, where you're going to back out. No. And the treatment starts on the 8th. So you have a day of blasting and a day of rest and a day of blasting. And this all takes part over a 10-day period. And I think it takes about 10 to 14 days to recover. But we'll see. Okay, so that's the update on the old tumour. And one note that you might like to hear, which is actually from the consultant, and this is actually in writing. It says, I understand that he has started a purely carnivore diet to try to reduce sugar exposure to the tumour. I have explained that there is no good evidence this helps, and the diet rich in fruit and vegetables is recommended. I've taken that under advisement, and well, to be blunt, I've ignored that bit.
What's the other bit that really cheered you up?
Hang on. Right, get this. I met Mr. Farnell in clinic today. He is fit for his years. Woo.
Which really does beg lots of questions.
Yeah. Apparently I look fine. I actually feel fine. I imagine all the unfine is a little bit further down the road, but we'll cross that bridge. The carnivore diet. Oh, well, that was started in earnest. Was it before the 13th? Wasn't it?
It was bang on the 13th.
Bang on the 13th.
30th
of November. Okay, so since the 30th of November and of today's date, I've lost 7 pounds properly. I'd say the water loss and everything.
You've lost nearly a stone.
Oh yes, since the 30th. I'm tracking it from the 13th. Okay.
Well, you're a silly bump.
Yes, I am. Yes, I've lost nearly a stone since the 30th of November, and it is only the 27th. Is it 27th now? Yeah, 27th. Let's call it the 27th. It's a nice day. Carnivore diet. A little bit tricky at first. I'm a little bit of a fussy eater, but when the alternative is a long and painful death, I'll go along with it. Noticed a few improvements. Obviously been on it now for a couple of weeks. I had an autoimmune skin condition, some psoriasis, mainly sore on my feet and hands. My hands, perfectly clear, absolutely not a trace of it. And the ones on my feet are clearing up quite rapidly. And I only think it's going to be another couple of weeks and they'll be normal for an old bloke. Anyway, never mind. So that's an improvement that's been noticed, and I've got to put it down to the diet because there's no other changes or indicators that have caused
because
this
you've
rapid.
been using the cream for like 5 years or something, haven't you?
Yeah, all the proprietary creams, nothing worked. It's autoimmune triggered. I never had anything before I had finished my second dose of hepatitis C treatment, which was interferon combined with an experimental drug I do not know the name of, and I haven't really dug into it too deep because that cured that, but obviously left a few reminders of
But it did get so bad at one point we were looking up to see if there were still any leper colonies.
yes, there were no leper colonies open in Weston-super-Mare, so we've just had to dig in and troll on with it. No actual proof on certain things, but I can tell you improvements with myself since being on the carnivore diet that I'm putting down to it for now until something else proves otherwise. But I have had very bad arthritis in my thumbs, knees and hips. It's not gone away, but I'm not bothered as much. I can do the stairs. Down's better than up, obviously. And sometimes it was a real bind getting up the stairs. The pain will make it quite difficult, but I appear to be managing them a lot better. The odd twinge now and again, but nothing that's going to stop me doing In my mind, I'm sleeping a bit better and for a bit longer. Usually we're up at the crack of dawn when the alarm goes. It's about 4:30 in the morning. But I slept in yesterday until 12 o'clock, and I slept in this morning until 10. So I think that's an improvement. The sleep also appears to be more refreshing. With liver disease and cancer and that, you can get periods of unrefreshing sleep where you wake up just as tired as you were, but I haven't had that lately, so I'm going to put it down to that. After work, again, with everything else that's going on, obviously it takes its toll. There was the inclination to pop on a bit of music after work. It wouldn't be too long before I was asleep. I used to do that about 4 times a week, maybe. But since I've been on the carnivore diet, I've only dropped off twice in the past couple of weeks. So that's got to be an improvement. I have noticed slightly more energy and a little bit more. There was a project to insulate the roof of the conservatory, which has been lying fallow for, well, actually months. I bought all the materials, I put them in the shed. I didn't have the wherewithal to get up and do it. It seemed like a monumental task. It was all a bit daunting, but I just got up the other day and went, right, let's crack on with this. And making really good headway on that. Got the first layer of insulation in, and tomorrow we're going to be doing all the itchy stuff. So yes, I think that's an improvement. I've woke up and got on and started to do things. There was a mention about dandruff. I do have dandruff. There's no noticeable difference there, but time may tell. I do suffer terribly from tinnitus and a blockage of the whatever it is tube in the left ear. No, I haven't noticed any improvement there. And sometimes that gets a little bit annoying. The frozen shoulder, it's very painful, but I have started to work it. I've got some 10 kilo dumbbells, which I'm spending 15 to 20 minutes on before I go to bed, doing various exercises, curls on with them, and over the head exercises. And although it can be uncomfortable, I can still stretch it that far. So it appears that only presents itself when I hold the shoulder in an unnatural fixed position for any length of time and then have to try and bring it back to normal. It does not like that. And I don't know if you've ever had a frozen shoulder, but yeah, so that's a bundle of laughs. I've got this here lump on the elbow. I don't know if anybody can see it, but anyway.
He's deformed. I was thinking of sending him back, but he's out of warranty.
Yes, I'm out of warranty. Yeah. My sell-by date expired a long time ago. So now we're on to best before. So yeah, this lump here, it's a thing. I've been told it's not.
It's like a ganglion.
It's just like a thing, and it gets covered in dry skin, and I itch it, and it comes off, and then it starts all over again. That hasn't receded. But we'll keep an eye on that. You never know what might happen. Let's get on to the saucy bits. Libido, people have mentioned. Does your libido improve with carnivore? I would say so. Libido's definitely there. The thoughts are there. The desires are there. I can use the word desires.
But I'm not always there.
Not always there. Well, I mean, she's there, but she's not there.
Asleep.
I mean, there's there, and there's there. Anyway, it's not. The stars have not aligned, but I'm sure they will. Got to give it time. Obviously, a house. Mama lives here. Daughter lives here. Oh, well, they do silent discos, don't they? Again, let's see how that goes. We will give you a heavily redacted report on that next update. That's all from me. I'm still riddled with nature's most fearsome disease. Trying to work on it with the medical team. Obviously, their insistence upon this balanced diet, I've had to ignore if I want to carry on and try to beat this by cutting off its food supply. I'm very, very anxious to see the results of the next scan, which will be done in a couple of weeks' time, and actually to take some interest in the diameter of this tumour. I was scanned during the training last week, so when I get in on my first appointment, I will ask to see the pictures and the measurement of the tumour to see if this, you know, we've only been in a few weeks now.
Yeah, to see if at least it stays the same.
This is stable.
Because will be now almost 2 months since the scan where they said it had grown by 0.4 centimetres.
4 millimetres.
Yeah, it had grown 4 millimetres since your previous scan.
Which was a month ago.
So if 2 months later it hasn't grown, we'll have our fingers crossed that everything's going as we've planned. So
we can only see. I mean, they come to a halt for varying reasons, run their course, act of God, but we'll see. I'm very, very keen, obviously, to get this small, but I'd like to know the diameter before they start zapping bits off it, just to see if it stayed stable, then that is a good sign, because obviously the little bugger grew 4 millimetres in a month, and yes, you wouldn't have a great you'd have a life expectancy of a mayfly if it carried on like that. So we'll see. I'm feeling a bit confident about it. I mean, if you look at the way that they carry out the sabre, any surgery is now off limits to me. My only offers of treatment are radiotherapy. Chemotherapy is considered, but I would have to be further on.
Well, you'd have to be nearly dead, and
yes.
in that case, what's the point?
Well, that might finish me.
You have your last few weeks undergoing a very invasive and horrible treatment, just to keep you alive to have a very invasive and horrible treatment.
Yeah, being fooled with the sweepings of the floor from Bayer's chemical plant.
Yeah.
God knows what all that stuff will do to you. So yeah, it is all about quality of life as well. As you can see, I'm all bouncy and woo. I'm okay at the moment, but I've had this thing now over 12 months. I've been through one lot of surgery already. I've had the ups, the downs, the disappointments, and quite frankly, the violent kicks that come to you along the journey. But we will see. But everything's going well.
Mm-hmm. Are you done now? Because it's not all about you, you know.
No, it's not all about me. Or Trevor.
Is that what you've called it?
Trevor the tumour. the first one I named Timmy, but Timmy's dead.
Yeah.
But Trevor came along because I bullied.
That was his big brother.
That was his big brother, and he went, right, I'm having you, and it has. So we'll see how Trevor gets on.
Okay then, so this is what's been
over to the wife.
This is what's been happening to me. Because things happen to me as well, you know, but usually more pleasant things than what happened to him.
Gasp.
So I started keto 19th of May, trying to lose weight. I started at 13 stone and 12 pounds. I got down to 12 stone and 2 pounds by the time that Steve and I went strict carnivore. I have lost since that. Well, I'm down to 9 stone. I'm not 9 stone, I wish. 10 stone, 9 pounds. So you do the maths. I've lost a lot in the last month. No. I got down to 11 stone, 2 pounds, and now it's 10 stone, 9 pounds. So I've lost a considerable amount just on keto. My body fat has gone from 46 down to 32. My water has gone from 35 up to 44. And my BMI, although you know you can't trust BMI, but it's a sort of ballpark thing, isn't it? But it's gone from 33 down to 26. and 25 I think is the top end of the normal range, so give it another couple of weeks, and I'll be going to the Olympics doing some kind of very energetic sport.
Can I just say that you're looking remarkably slinky, and if obviously if my libido doesn't go up, then there's something wrong with me again.
Okay, so problems that I used to have: knee pain. I had a motorcycle accident and snapped this kneecap in half. It's always been a little bit dodgy. I haven't been able to kneel down since. And when I put on a lot of weight, it was getting to a point where it was really hurting me all the time. And there were some positions I couldn't turn in. Now, stop it. I meant when I was standing up.
Okay.
And obviously with the height difference, we can't do anything standing up.
Okay.
So
it's 1.5 inches. It's not that much.
you still need to step, won't you?
Yeah.
So, yeah. So if I just like changed my direction and started to walk in a different direction, sometimes my knee would just buckle. So anyway, the knee pain has mostly gone. I get a very slight twinge every now and again. And this is, I broke my kneecap when I was 19 years old, and I'm a little bit older than that now. Lower back pain. Suffered terribly with lower back pain. I used to wear a TENS belt all the time. Anytime I was doing any kind of physical work, I had to have a TENS belt. Otherwise, I couldn't do it. Anything like gardening or just leaning over a project when I'm stood in the shed, just painting something, leaning over a piece of furniture. Agony. Absolute agony. And I couldn't have carried on without a TENS belt. I've not been doing too much of the gardening or any projects, but I do know that my back really doesn't hurt very much anymore. Bursitis. I have bursitis in this shoulder, which means that if I say I've got a shopping bag and I need to reach into it to get stuff out, when I get to here and then reach in, absolute agony all the way down my arm. Well, look. Gone. It's blooming gone. Dermatitis. Da, da, da. My palms were in tatters with dermatitis.
So were mine as an adolescent.
Gone. Gone, diddly. Gone. Plantar fasciitis. Suffered absolutely terribly with it for about 2.5 years. I put most of that down to how much flipping weight was on my feet, but it was absolute agony. I could barely walk with it sometimes, and the amount of money I've spent on footwear and stuff to shove inside my feet, inside my footwear, to make life bearable, I couldn't even tell you. I could probably buy a motorbike with the money I've spent on corrective footwear. But that's pretty much all gone. It's just, like, again, slight twinges every now and again. Blocked nose. I've had an addiction to nasal sprays since I was possibly about 20 years old. I can't bear for my nose to be blocked, but I had a really bad cold when I was about 20, and I was constantly using this stuff. And it says on it, if you have to use it for more than a week, you need to go and see your doctor. But I just never went to see my doctor, and what it does when you use it for a prolonged period of time is it's a bit like cigarettes. If you have a cigarette, it makes your body need another cigarette, and it got to a point where every time I'd done my nose, like a couple of hours later, I'd have to do my nose again because it was just having that like circular effect. And so I've been addicted to that since I was about 20, and now I think I probably use the snorty stuff twice a day, and at night time it's literally just because I'm terrified I'm going to fall asleep and half an hour later it'll wake me up because I've got a blocked nose. So I'm trying to get off that, but it's really decreased so much. It's brilliant. Constipation, no, don't have it anymore. Majorly sticky poops, no, that's gone. Mainly because I hardly ever poop anyway. Anger. He will tell you I'm a very angry, snappy person. I would...
Wouldn't dare.
I would verbally slap someone rather than find out whether they've done the deed or not. Every single time. It's accusatory, like, oh, the F's done this, and where the F's this, and where the F's that. And every time somebody did something which I thought was, especially within the family, which I thought was like, why are you doing it that way? I'd be like, why are you doing that way? It's so much easier to do it this way. Really snappy and horrible to people. I'd apologise later, but that doesn't stop what they're feeling when I'm picking on them. And I can only defer to the husband. How's it been since I started Carnivore?
No, it's no. You are better.
It's practically
did have that
gone.
period of people running away to different parts of the house when you come home. You know, child, Nana would be upstairs.
And that is actually true. They did. They disappeared. And I'd only have to say one word to my mum when I got home, and she'd go, I'm going upstairs. And that, I think I pretty much, I'd say that's 80% better. I don't know if
yes,
you
it is better. I mean, it was, I've got to be quite candid, it was almost every day you come down from upstairs and, oh no, what you come down for? And there'd be something from someone to criticise.
Yeah.
And yes, it was getting.
And even if I didn't, you had that feeling of
that it was coming.
Yeah.
But no, the household itself is a much more pleasant atmosphere, as you can see by my stupid approach to everything. I'm quite light-hearted and devil-may-care most of the time, and yeah, the improvement there has been a breath of fresh air, a nice open door with some nice air blowing through it.
I'm almost the wife you always wanted.
She is.
Right then, so melancholy. There's not really much that's changed there. So even though I'm like quite jolly and jokey on the outside, I still have quite a lot of melancholy on the inside, and I've not seen a change in that. So I need my mental health to improve quite a bit. The motivation, there's not much change in the motivation. I say there's not much change. There's one thing that has changed. Because, as Steve will testify, I get really motivated to do things, and I prepare everything ready to do whatever it is I've decided I really need to do. And then quite often I'll do that thing once, and everything that I've prepared just gets chucked in a shed, and and we'll never see it again, will we?
No, we see it quite often.
Yeah,
like,
we trip over.
It's very difficult to miss the canoe. Don't you think? Very difficult to ignore the canoe.
Which I never use. Which I never ever use. I've got all the kits going in because I wanted to go canoeing, and I never ever use it. But anyway, the one thing that so far I've been managed to keep up with, even though I've had the same feelings of like, oh, you know, when I used to try and get fit, oh, I should go down and do something. I should go down and do something. I should go down and do something. I just never doing anything.
Suited us.
Yeah. So the only thing so far that I've been doing, even though I've had that, oh yeah, I should go and do this YouTube video, but oh, I'm worried I don't do YouTube. I'm not like all the other YouTube people, and I've got to get a special thing to hold the camera now because our last video was rubbish. But and I've got to get a light, and we've got to get microphones, and I got it all, and then I've spent 2 or 3 days going in my head, oh, what if it doesn't work? And this morning I just kicked myself up the butt and said, well, what if it doesn't work? Just go down and do it. And this is us down here doing it. Okay, so hypersensitive teeth. Because my gums have been receding over the years, I have all around that, like my top of my teeth are exposed, and it was so bad that if I put anything in my mouth that wasn't exactly the same temperature as my mouth, you've put me off now, you bugger. If I put anything in my mouth that wasn't exactly the same temperature as my mouth, it could be a couple of degrees above or a couple of degrees below. My teeth at the top was like somebody was drilling into them. It was absolute agony. that's gone. I literally, I mean, I'm not going to suck an ice cube anytime soon, but I can have a cold drink of water and I can have a hot drink, and I don't have to get it to temperature in the middle of my mouth before I can deal with it. So that's absolutely brilliant. Also, I don't need to brush my teeth anymore. When I was eating carbs, another thing you'll testify to, what was the one thing I would say when we pulled up in the car when we got back from work?
Your teeth.
About brushing them.
Yes.
I can't go out to get in and brush my bloody teeth because they were absolutely coated with whatever it was I'd been eating. Usually it was low carb bread that made it do that. But anything at all, I found that my teeth were completely coated. And I just had this desperate urge to brush them. Well, now I don't even use toothpaste. I don't use toothpaste. I don't use mouthwash. My breath does not smell. And my daughter used to say to me all the time, "Good God, Mother, your breath stinks." And I'd be like, "Oh, right, okay, I've just brushed my teeth. No difference. My breath still stank. But it doesn't smell anymore. And no toothpaste, no mouthwash. So I'm happy with that." Sleep. I used to get up between 1 and 2 hours between 1 and 2 hours every night to go to the toilet several times a night. And I'm now get 5 or 6 hours all at once without having to get up. Now, this brings me on to my weak bladder. Ever since having my daughter 18 years ago, my bladder was wrecked. If anyone out there's just about to have a baby and people say to you, "Don't forget to do your pelvic floor exercises," do your pelvic floor exercises. Because if you don't, honestly, you won't be able to cough without peeing your pants. It was dreadful. But also that meant that I've got a weak bladder, which means that I could only put, say, I need to go for a wee and I would only do like maybe an Actimel bottle of wee, even though I was absolutely desperate. And I thought that was never ever going to change. And it would be like every hour during the day and every hour and a half to 2 hours during the night. That has gone completely. I can drink my whole litre bottle, show them that litre bottle of water. I could drink this whole litre bottle of water and still manage to not have to go for a pee for an hour after drinking that. And when I go to the toilet, I properly go to the toilet. I have a nice long wee. Most people won't understand what it's like to not be able to do that, but it was awful. It's much improved, and I blooming love that. What have I got left? Oh, I used to always check my heartbeat because I felt like I had an irregular heartbeat. It was like do 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 do. Yeah, it was something like that. And then sometimes it like giddy up and then it'd stop for a couple of beats and then it'd go back to normal and then it'd do giddy up, and I was always testing my heart rate. I was generally around about, my resting heartbeat was around about 84 beats a minute, and I checked it last night, 62. So that makes me very happy. Down to the libido, I've got an absolutely amazing libido. So no, the libido has improved very, very slightly. That's all I'm going to say. I think that's about it for me. Also, I mean, obviously, look at me. I'm getting a very goddess-like figure. And I crossed my legs earlier on, and my daughter noticed that this part of me here was the size of this thigh before I started losing weight. So now my two thighs are the size of what this thigh was when I started losing weight. So overall, I'm pleased as blooming punch, and that's it for me.
Oh, and I'm pleased because we've had the drug delivery.
Oh yes, it's just had a little drug delivery.
Hang on a second. There we are. Isn't that nice? Now, for all our viewers that aren't in the National Health Service, all this is free.
Oh no, don't gloat, because it's not. No, it's awful that they have to pay for medicine everywhere else. I don't think gloating is.
I'm not gloating.
No, not very much. Are you just ultimately relieved?
Yes, because
You'd be dead if you.